Welcome back to the Basics series. Today we're talking about medications that you might want to take before seeing your rheumatologist and those that you shouldn't take before the first appointment. This will somewhat vary according to the situation that you find yourself in, whether there is a lot of diagnostic uncertainty at the point of being referred or waiting to see the rheumatologist, and of course how severe your symptoms are. But there are some basic rules of thumb. Nobody wants you to be suffering or struggling with high levels of pain, especially if you're waiting a long duration, say in an NHS sector. If it's not deemed that you have an urgent appointment, you might be waiting several months before your appointment and you're struggling with pain now. Most people will have tried some over-the-counter painkillers. Some don't, either because they don't like taking pills or because they were worried about what the effects of those medications might be on the investigation results. I'll split the kind of simple painkillers in terms of tablets into three main classes. The first class is paracetamol. This drug is a simple painkiller. Most of us have taken it. Also goes with the name acetaminophen. It's perfectly safe to take this in advance of your appointment, so long as, of course, you haven't got any problems taking it, like liver problems or allergies. But and also it's unlikely to have any impact on the rheumatological condition. So you shouldn't see any shrinkage of the clinical signs like swelling just by taking paracetamol. The only thing it might do is, if fevers are part of your symptoms, which they can be in some rare instances, paracetamol is a very effective drug at controlling fevers. So when you come to the appointment, you may not have the fever that you're having every day, for example. And it can be useful if regular fevers is your presenting problem, to have it recorded officially on the hospital equipment. So we've got that officially recorded, if you like. Sometimes people don't like to take paracetamol on the day of the appointment as well, especially if it's quite an effective painkiller for you, because you kind of want the doctor to see you at your worst. It seems so common that my patients come in and say, of course my symptoms have got better today, the day of my appointment, having been terrible the last few weeks. Okay, so the second class of typical pain relief that you might want to consider is an anti-inflammatory drug. The class, it would be non-steroidal anti-inflammatory drugs, and there's a whole range of drugs here. Some are prescribed, some are over-the-counter. These are things like naproxen, diclofenac, indomethacin, celecoxib, etoricoxib, lots of different types of drugs. But they have both pain-killing effect and an anti-inflammatory effect. Now, in aggressive inflammatory arthritis, it's not likely that the anti-inflammatory effect is enough to dampen down what I will find in the clinic. If you have very subtle inflammatory disease, it might dampen it down to the point where I'm not seeing something that was on the cusp. And in some specific situations, we don't recommend having anti-inflammatories because it can interfere with investigations. So a good example of this, in inflammatory back pain disorders like ankylosing spondylitis, regular use of an anti-inflammatory before the scan could lead to a reduced pickup of inflammation in the spine. Since most people aren't going to be going straight into having an MRI on day one, this usually isn't a problem. And if you are struggling with pain that's not adequately managed with paracetamol and you're able to tolerate a non-steroidal anti-inflammatory drug, I think it's reasonable to go on to that. The third type of drug that you might see in a painkiller is one that will have a variable level of availability according to the country that you're in. So, for example, in the Emirates, opiate-style medications like codeine are not accessible without a prescription, whilst in the UK, small doses of codeine and dihydrocodeine can be found in some over-the-counter prescriptions. This is a pure painkiller. It does nothing for inflammation, and in long-term inflammatory disorders, it really is a problem. abuse, dependence, tolerance, all of these issues, but at the very least, constipation and other unpleasant side effects. So I don't advocate any use of opiate medications unless it's really, a short term, I need this for the next couple of days to get me through the high levels of pain until I got my appointment. Non-drug therapies are well worth trying because if you're still struggling and you're still waiting to see someone, you want to do something. So this could be things like heat packs or cool packs, or you might put menthol gel on, or some kind of warming gel like a deep heat gel. Some of my patients have tried things like TENS machines or massage or acupuncture. So there are other ways that you might want to manage the pain while you're waiting to see the rheumatologist. I don't have any problems with most of the herbal medicines, but some of these can have active ingredients within them. And if you're not sure, then you could discuss this in the first instance with your family medicine or general practitioner. Or if you have direct access to the rheumatologist, you might simply send them a message asking if they'd have a problem with you being on any of these medicines before the first appointment. So are there medicines that we really don't want you to start? Steroids is the big one. Steroids are wonderfully effective in the short term, but they're a big problem drug in the long term, and I'll do a video on all of the issues long term about steroids. They are also capable of melting away many types of inflammation. So if you present with active swollen hot joints and you're given steroids, there's a risk when you turn up to the appointment that the rheumatologist isn't seeing any objective evidence of you having inflammation. Now, if you have a very good story, you got better with steroids, it might not be a problem. It also might not be a problem if the first person that's seen you or the first person that's investigated you already has overwhelming amounts of evidence this is a particular rheumatic disease. So if you had some bloods and the blood showed very high levels of inflammation, you've also had antibodies being checked and they're all strongly positive, you've got a family history of rheumatoid arthritis, a medical professional has examined you and said, I can clearly see your joints are swollen, and then they give you steroids because they need to give you immediate relief. It's not such a problem if all of those symptoms melt away by the time you see the rheumatologist, because we already have so much data to back up the fact you probably have rheumatoid arthritis. But the frustration can come when you're on the cusp, and many people, when they first present, it's not clear that they have an inflammatory disorder. And if we then melt away the symptoms with a steroid, it can delay things because I might need to come off the treatment and suffer those symptoms returning so I can reassess and see that there's evidence of active inflammation. And that's important because we're then going to be putting you onto a long-term treatment. So you want to have that certainty that that long-term treatment is justified. Finally, and not that I'm expecting this to be likely, but don't take other prescribed medicines, especially taking someone else's prescribed medicines. So you might know someone that's got rheumatoid arthritis and they're taking methotrexate or they're taking tocilizumab or something like that. Obviously, don't start taking their medicines because you've self-diagnosed yourself with that condition, thinking it might be the right thing to do. Hopefully, that's pretty obvious. So in summary, I do think it's perfectly fine and reasonable for people to take medicine before the consultation. In fact, I'm slightly surprised when people say, well, I haven't taken anything, I just wanted to see you first, because if you're struggling with pain, my first thought is, what have you done to try and help that? But many people do have worries that if they take medicines, it's gonna mask things for me. You should be fine with paracetamol. In most cases, anti-inflammatory drugs like ibuprofen are okay, but make sure you avoid steroids And if you do have concerns about whether this drug might be safe or not, you can try and liaise directly with the rheumatologist you're going to see or with the referrer, so your general practitioner and family medicine doctor, in advance of the appointment, just to double check. Look, I'm looking at trying this new medicine. Is it going to be safe and okay before I see the rheumatologist? So I hope this was useful. Have you thought of any medicines that you took before your appointment? Is there anything I've missed off here? Are there any other pain medications or treatments that you think might be helpful for patients who are suffering and are waiting to see a rheumatologist? If so, I'd love to hear your thoughts in the comments. Thanks for watching.